Good evening, everyone. Welcome to the Long COVID Clinic, What You Can Do, with me, Dr. Binita Kane, and
myself, Helen, Oakleigh, patient advocate for charity Long COVID Support.
Now, we've got a really exciting session tonight. We've got the amazing Gez Medinger, who's probably the most recognisable patient advocate on the planet. And we're going to do things slightly differently tonight. So to save Jez's energy, we are only doing a 40-minute session. You can still put comments in the chat, and we will be having a look at those as we go through, but we won't be having the Q&A that we usually have at the end of the session. And Helen is going to be joining us all the way through today, because we're not having Q&A, and it's going to be lovely for the three of us to chat. So with no further ado even, I'm going to bring Gez onto the stage. Lovely to see you, Gez.
Yes. Hi, Binita. Nice to see you too.
And we should just mention as well, you're currently up a mountain in the Alps, and you've got very good signal at the moment. But if there is any dodgy network issues, that's probably why. So we've not got very long, Gez. So I'm just gonna kick off. It's been five long years of COVID. You have done a huge amount of work for the community. Are you okay just to start with, what was life like for you before you got COVID, and when did you get COVID, and what happened to you in the aftermath?
I was a fairly textbook overdoer beforehand. I traveled a lot. I worked very hard, freelance filmmaker. And though that job is fundamentally hard work, very long days, very full on, zero downtime. I really valued and enjoyed my fitness. So I ran marathons. I played a lot of football. I did mountain biking, all sorts of stuff. And I was probably doing more than I should have done. It's one of those things, right? And I was actually just at the end of my training block for my fourth marathon when I caught COVID in March. So March 13th, 2020. Initial infection was fine. I say fine. Unpleasant, weird. You know, I didn't need to call an ambulance or anything. And I was better than my friends who were sicker than me. But they got better after a week and a half, and I didn't. And stuff started getting really weird. And then I recognized a symptom I had from glandular fever when I was at university, so 20 years earlier, weird feeling in my throat. And I was like, oh God, it's going to be this again, is it? Because that knocked me out for a year afterwards. And at that time I thought, I can't be doing with a year of this. Little did I know that 5 years down the line, I would still be suffering. Not as bad as I was, but still, I can't go back to my old job yet, put it that way. And I can't do any sport apart from what I'm out here doing at the moment at a very reduced level.
Yeah, absolutely. And Helen, I'm sure you can identify with so much of what Gez has just said.
Oh, yeah, massively. I mean, I was also traveling the world with work and massively overdoing things, playing league sports, and yeah, as like so many of us got such a similar timeline. It's very frustrating, isn't it?
Yeah, and of course you guys got sick in the very, very beginning of the pandemic. So, really were the first wave of people to develop long COVID. Now, Gez, 5 years on, you are hopefully a little better than you were at that time when you got sick. You've tried an awful lot of stuff, haven't you? And I know we're not going to have time to talk about all of it today. Can you talk us through kind of, your approach to looking for answers and getting better?
Well, so what I would say is that, yes, I am kind of doing better now than I was at the start. Some of that is due to a better understanding of my condition and a better management, better pacing, better, all the rest about recognizing the signs early. There's all sorts of things. I pushed it way too hard. I was still running for 2 months at the start, right? And I was thinking, I'll keep my heart rate down. I'll be fine. I'll just go really slow. And I was like feeling disastrous after every jog. And it didn't occur to me for 2 months to think maybe I should knock this on the head. So, I've got better at doing things like that. But the flip side of that is that I've had 3 COVID infections, and each one has given me new symptoms. And I haven't necessarily shrugged off all of the new symptoms I've had from infection 2 and infection 3. So I have got some new stuff into the mix. And I'm now more dysautonomic than I was in that first year, funnily enough, because that was something that came with the second infection. As for my approach to doing stuff or trying stuff, I've got a fairly high I've always been a risk taker. Whether it's sort of career risk, whether it's jumping off cliffs or whatever, right? That's something I've always been okay with. So I haven't been too scared to try things if it seems like there's a logic for why it might help, and the safety profile isn't insane, right? I'm not just, drinking bleach like Trump suggested in, in year one, right? There's certain things which are obviously not clever, but I would sort of try anything that seemed like it might do something, maybe, because that's the thing, right? It's such a debilitating condition and you've got so few things that you can do about it. You've got no diagnosis, you've got no treatment, you've got no prognosis. It is desperate, and you will sort of roll the dice on anything because you feel so bloody awful that you'll take a 4% chance of feeling 5% better, even if there's an equal chance it'll make you feel worse, because how much worse can it get? So and certainly at the start, I think there was a bit more of a Wild West approach to the way that people were approaching things that they were trying. And one of my bad experiences was with ivermectin, which put me in hospital for a week. And that was a bit of a lesson, I think. Still people talking about ivermectin and isn't it great? And I have to say, not for me.
Yeah, and I think, Helen obviously it's co-founded the Long COVID Support Group, which is, how many people are in that now, Helen?
In the charity we have 67,000 members now, and the number is continually growing because as Gez of course has experienced as well, I've also had 3 infections, and the chances of new symptoms after each infection obviously grows. And I also had the very similar experience at the beginning as well. It's interesting, I continued with sport for 7 months. I did stop it for a while, and I slowly built it up, and I thought it was slow. It was so slow. Month 7 it wasn't slow, and then I had 18 months basically in bed and so off the scale ill, and
that advice, Helen, as well, to rest and pace and not go back to sport and not exercise too early, particularly for people back in the day like you guys who might have had more cardiac involvement, more heart involvement, things like that. It was just the wrong advice being given, and that's such a shame.
And now, for anyone listening who is not sure, exercise is so dangerous if not done properly. And that's the key, because also, of course, as you both know, with the POTS elements, it's really important. But when you've got all the things that come into play with MECFS and everything that can make it so much worse, it is so important that it's done right.
And there's a way to do it safely, and doing graded exercise is generally not the best way to do it if you suffer with post-exertional problems. So Gez, the list of stuff you've tried is as long as your arm, isn't it? We haven't got time to go into it, but there's how many treatments? You totted them up for us, didn't you?
Well, I'll rattle through them, and again, I've probably forgotten some here. Supplements, by the way, I've tried them all, so they don't really count, but I'll run through the rest of it. So ivermectin, did that. Something I've not spoken about much publicly before is I had a few rounds of Apheresis in Mulheim. This was in 2021, so quite a long time ago. Vaccination, arguably. I had a vaccination and then 2 of the boosters. You could argue that was a roll of the dice, because some people were saying they got better afterwards, or some of them got worse. Hyperbaric oxygen therapy, cryotherapy, red light therapy, cold water immersion, methylene blue, LDN, nicotine patches. One thing I've pulled out of the supplements, high dose benfotiamine, which is vitamin B1. Anticoagulants, I've tried anticoagulants in terms of my brain's got clopidogrel and Pixaban. natto and lumbrokinase, ozone therapy I've done, leech therapy I've done, and then a bunch of IVs with all the stuff that people throw at long COVID, like glutathione, alpha-lipoic acid, all of that sort of stuff that's supposed to help. And I'm sure there's loads of stuff I've not included on that list, but pretty much anything that anyone's talked about as a treatment for long COVID, I've given it a whirl.
Yeah. And that it doesn't sound cheap having all of those treatments either. I mean, people are throwing thousands and thousands of pounds at these treatments. I mean, apheresis is interesting. And if you don't mind talking about that, I think Mulheim was an interesting place back in 2021. And as someone who went, like I went to Jasmine to Mulheim, she didn't have apheresis, but she did see Dr. Jaeger, who was heading up. But it was quite an extraordinary time, wasn't it? Where Mulheim, this little town in Germany, became this mecca for long COVID,
Oh.
partly because of you, Gez. I think if it hadn't been for you,
Yeah, although not publicly, that was sort of the quiet network of people trying this.
Yeah, I think it was through a mutual friend of ours that I found out about Mulheim. So, indirectly, perhaps you've really helped my daughter get better, because it was going to see that doctor who was able to prescribe treatment for her. But it was like nothing I've ever seen before as a doctor myself, that all these people were descending from all around the world, having this, what was effectively an experimental treatment. What was your experience with it?
So it definitely did something. I'll say that. So it's funny, like coming off, you spend about 2 or 3 hours in the chair and they filter your entire blood volume like 3 times or something. Correct me if I'm wrong there. But getting up out of that chair and suddenly having this clarity, like the fog had been lifted, and suddenly having this freshness, just in terms of not feeling poisoned, is kind of the easiest, most subjective way of describing it. And then going back to the apartment and feeling knackered, but knackered in the way that I used to feel knackered, not long COVID knackered. It was a very honest, tired feeling, as opposed to this kind of rancid fatigue feeling that sort of bubbles from the inside out that you get with long COVID. And it would knock me out for a couple of days afterwards, which is to be expected. And I think after a few rounds of this, I was genuinely doing better. Unfortunately, better to the point where I had more functional hours in the day. I went out to Germany 2 or 3 times and had 2 rounds of apheresis each time I went. And by the end of this, after however long it took, over a period of a couple of months, I was genuinely doing much better. I had, more active hours in the day. My spoon quotient increased by like 30 or 40%, something like that. But unfortunately, it was at that point that I had the ivermectin hospital stay, but knocked me sideways. And very shortly after that I caught COVID the second time. And that COVID the second time sent me right back to the start of the same as the first one, except with extra dysautonomic stuff. And I didn't have apheresis again after that point, simply because it was A, expensive, B, invasive and unpleasant. I didn't particularly enjoy it. I started to get a bit needle averse after that. When I was in hospital, just having needles jammed into me the whole time after the ivermectin thing, I was just so traumatized by having so many needles stuck into me. I was like, I can't keep doing this to myself. So no, I haven't gone back to do more, but it definitely shifted some stuff for me, and I definitely did feel a bit better. But I never quite, the feeling of, it did feel a little bit like, and again, this is just from a feeling perspective, like, oh, we've cleared out all this crap in your blood, and now you're suddenly getting some oxygenation back into your tissues and the rest of it. But it didn't quite stick as much as that first feeling did, as in it felt like your blood was just reclotting up again afterwards, fundamentally. That's what it felt like to me, is that it wasn't a long-term fix. It was like, yeah, clear the stuff out, but then it's like cleaning your house. It gets dirty again, and that's kind of what it felt like for me.
And I think there's been, obviously mixed experience of people who've had apheresis, and this is why we need the studies, we need the trials. We've got like all treatments in long COVID, it helps some people and not others. And as you say, it is invasive, it's expensive, and for something where we don't really know who benefits and who doesn't, it's quite a big undertaking. But thank you for sharing your experience with that. I suspect there's been lots of chat about this in the support group as well, Helen, probably not so much recently, but maybe back in the day.
Yeah, there is. I mean, of course, most people simply can't afford it. I was able to try it myself. But I think one of the best things I got out of it is I got an international community group that I've stayed in touch with people from all around the world, and we were able to keep up with the research, and that has been so invaluable. As another kind of support group. And I think that is a real thing, when you're trying things, even if it's just a tiny percent that it might work, even though you can't really afford it, you end up, trying just to learn, because you just want to get better. You just want to, get some of your life back. And not Absolutely. Everyone's experiences are going to be the same.
But the community that you talk about, I mean, Gez, the community that you would have built up through Mulheim, through the patient community, was absolutely essential, wasn't it? It was I can't think of a word to describe it, but you couldn't have got through that time without it, really.
In terms of the engagement with the content I was making, the research I was doing, hugely. And I think what was fascinating for me there was being able to sort of be a conduit for all of these questions that people had. I mean, this is kind of using social media for good, right? As opposed for evil. Like we sort of, a lot of us feel like it's used these days. But to be a conduit for all these questions that people had, and then being able to ask them to everybody, 2,000 people, I was getting in the responses. And suddenly from that 2,000 people, you can collate all of that stuff together and I can present it back to everybody. So it was a perfect way of being able to use all of us as a community in a way that answered the questions that we had. I'm just going to quickly comment on a couple of comments which have popped up in the chat, which I can sort of deal with very quickly. Did I get better after vaccination? No, it didn't make me better, but it didn't make me that much worse. Which of those treatments worked and which didn't on the list? And that's going to have to be a video that I do on my own channel because that's going to be an hour long. Have I tried SGB, stellate ganglion block? No, I haven't, but I would. It's a bit hardcore, that, and it scared me a little bit, having needles plugged into your nerves and your neck and stuff. But the small sample of people I know have had it have all had some form of improvement, especially people who have dysautonomia. So yeah, but again, it's a big thing, stellate ganglion block. It's not like taking LDN or something, in my opinion.
Yeah. And thanks for that, Gez. I think you know, you've tried a lot of those treatments. A really reasonable question. Well, what is it that has got you better? And you know, I think there's somebody who's written here about how do you build up exercise safely, apart from the obvious. And I think this is a great question because not all pacing is actually pacing. Well, what people think is pacing is not actually pacing. And you guys have talked about how you thought you were building things up really slowly, and then you know it led to worsening symptoms. So for me, this is the absolute cornerstone. All the medications, everything that you can prescribe, symptom control, is really important, and people aren't doing the pacing properly, it's not going to work. This is the cornerstone of recovery. So how have you adjusted to that, and are you happy to sort of talk about what you're doing at the moment?
Yeah, absolutely.
Right now,
so
this week.
so the first thing I would say on this subject is to work out what kind of pacing you need to do. And this depends on, if we're going to do a very broad phenotyping for long COVID, and I'm going to steal the one that Professor Carmen Scheibenbogen and Klaus Wirth have used, which is basically like ME/CFS and not like ME/CFS. The difference being, does your crash come 24 hours later or 48 hours later? Are you essentially spoons limited in any given day? And if you exceed that number of spoons, that causes a crash. And then there's the other side of it, which is the dysautonomic side of things. So a lot of people who are in the ME/CFS category are going to be dysautonomic as well. So they have a dysautonomic reaction to activity. But some people don't have the spoons limit, but they are dysautonomic. So I think one of the things when it comes to working out what sort of pacing you need to be doing is working out which of those two camps you're in. Because in terms of how you start exercising, that's going to have a huge impact on how you do that pacing. So I've got a friend who's got long COVID, who he can go for a very gentle 5K run, no problem. So that'll take him half an hour or something. No crash, no nothing, that's fine. So he's not spoons limited, because that would pretty much certainly use up all the spoons for someone with ME/CFS, especially on COVID. But if he runs for a train, might take 25, 30 seconds, he's got a bag on his back or something, bang, nightmare, because he's exceeded his autonomic ability to regulate what's being demanded of his body. So he's in that camp which has to be careful about how much they do in the moment, and there's a hard limit to what the autonomic demands are of that activity, which is why you have to break it up, slow it down, all that sort of stuff. If you're in the ME/CFS camp like me, I've also got to be very careful about not just that side of stuff, but also how many spoons I spend. So if we take the example of being out here in the Alps, skiing is the only sport or activity that I can still do. And the reason for that is that it's weirdly pacing friendly, because you can do it for as short a time as you like. I can do 2 turns and stop. And I can let my heart rate settle down again. And by the time I've got to the bottom, I can get in the lift and I can sit down and I can get to the top, and then I can sit down, have a hot chocolate. I can really break it up. And so that's how I manage the autonomic demands of it, by not doing too much or too hard for too long. And then the spoon side of it, I'm just up there for an hour, and then I come back and I make sure I do nothing else in the day, apart from this today. So I did a bit less skiing to leave myself an extra spoon or two to do this. But I couldn't do that sort of activity and then do all the other stuff I would have done in my normal activities of daily living. So what I would say is, if you're thinking about trying to introduce activity, if you're really up against the crash limit or the pen limit, with your activities of daily living, there isn't room there to start introducing activity as well. So you need to drop some other things out to be able to replace it with activity. If you're not up against that crash limit, you might be able to introduce some elements that don't take you over it. And again, a huge part of this as well is recognizing your own symptoms about when you're starting to do too much. What does it feel like for you in terms of working out what those pacing limits are, in terms of how you break an activity down? What are the little signs for you? Like, is your heart starting to flutter a little bit? Are you getting a bit short of breath? Are you a bit dizzy? Is there a bit of fog coming down? You know, all of these sorts of things that can tell you that you've been doing something for too long. Again, I don't want to just rant on about this for hours. I want you guys to feed in too, but it's a really complex subject. It's really complex.
It's go on, Helen.
No, it's good. It's good to hear you talk about it. Of course, you know, I'm just seeing some of the messages in the chat as well, you know, because there's a whole range of responses, and I'm so jealous that you're able to go skiing. But I know, of course, that the limitations that come with that, you know, I understand that. And I think if you haven't experienced some umbrella of the chronic illness range of conditions, it's very difficult. Oh, well, you're skiing. Oh, well, you're better now. I can imagine people thinking that. And of course, it's so far from the truth, because you know, although I'm not at your level yet, hopefully I will be, you know, but I understand that level of frustration at wanting to do more when you can't. And in response to the people in the chat, I would say, you know, because there's a lot of people, it's not one person in particular who have commented various things. You know, I think understanding what your limit is, and you've spoken about this as well, is what makes it key. So, for example, I have an electric wheelchair because it allows me then to talk, and it allows me then to have less brain fog. It allows me then to function better. Am I able to do all the daily living stuff? No. But does it mean I'm able to go out once a week? Yes, if I'm having a good week. So, you know, and that is amazing. It's not up a mountain, but it's outside. And it is understanding and accepting that, yes, I'm in, you know, 5 years in, I never in a million years thought I'd still be at this stage, and that being a success. But you know what? It is a success. And it's understanding that being proactive about rest, like you say, you know, for the rest of the day after you have done too much, is the key. And if other people don't understand it, lucky them. You know, it just means that they've not lived it.
Absolutely. Yeah, it's so hard, and it's heartbreaking reading some of the comments actually in the chat and seeing how poorly people still are this far on. But the pacing side, again, we could really just carry on talking about that for the rest of the session. There are other videos, live streams that are on this series. So there's one with Todd Davenport, one with Robin McNellis, where we go into pacing in a lot more detail. Gez, I'm sure you've got some on your YouTube channel as well about pacing. So there is lots of resource out there, but it's not easy to get it right, especially when you've got a family or a job or all of those things. The other thing that, Gez, is something when we were planning the session, we talked about pacing, and you said it's hard work, it's boring, and it's a sacrifice, but it's the thing that has helped the most, right?
Fundamentally, yes. I think one of the hardest things about pacing is that it's not something that you can do in reaction to a symptom that makes the symptom better, really. It's something that you do in the hope that a symptom won't appear in the future. So in terms of seeing the rewards of pacing, it's a hard thing to get the reward from doing it. And it's really hard work to do it emotionally, mentally, psychologically, because it requires so much sacrifice, so much opportunity cost to do it. And it requires this kind of mental, emotional dexterity to sort of rationalize yourself. So there was a study that was done back, I don't know, I'm going to say 1970s, really old study. They got a bunch of kids and they put them in a room, and they realized they could group these kids into two groups by offering the kids a sweet, and they can either have the sweet now and they're a 1 sweet kid, or they can wait and they get 2 sweets, but they have to wait and be patient, and then they get the reward for it. Like, pacing requires you to be like a 5 sweet kid, where you, and the 5 sweets you get aren't even sweets. They're just not punches in the face. Right. So that's how it works for long COVID. You have to wait, and to have all of this just to not get punched. And I think that's one of the hardest things about pacing, and why there's so much resistance to it, because it just seems to be this nebulous concept that's hard to nail down. It's hard to get the reward when you do it. And it's no fun. And I'm still not very good at it. I'm better than I was 5 years ago, but I still get it wrong the whole time, you know?
Yeah, it's hard. It is really hard. And then I think for people who are doing it with children, like I just sort of had to do, it's very, very challenging trying to get a child to pace properly, especially when they start getting a bit better. I'm going to move on from treatments. I think, was there anything else very quickly that really helped you from that big, long list of treatments? I think.
So the things that are still part of how I hold myself together now, it is pacing. It is just being really on top of managing what I expect of myself, and all the different ways that comes about, and antihistamines. After I went to go fasting, I didn't need the antihistamines to control my MCASI inflammatory reactions whilst I was fasting. And I went home and I got into this sort of boom bust cycle of being good for a week, crash for a week, good for a week, crash for a week. And I thought, you know what, I'll just start taking the antihistamines again, even though I'm not that inflammatory. And it seemed to sort that out. Which wasn't something I was expecting, because that wasn't the reason I was taking them in the first place. I was taking them to manage my MCASI allergic type reactions. But turns out they actually did mitigate some of the boom bust stuff. And that's almost kind of it really at this point. So there are other things that have helped along the journey, and I can talk about that separately in a video I do on my own channel. But in terms of what I'm doing right now that holds the bits together without falling apart too much like Humpty Dumpty, it's just that really,
Yeah. Okay.
And I just want to pick up very quickly on a comment here that someone made, which was pacing, prioritizing, and finding the joy. And I think that is so key to finding your way through the misery of pacing, is actually recalibrating where you find the joy in your life and understanding that the things that you used to seek joy from may not be achievable now. And actually there's all sorts of other places you can find joy that are much simpler. And just sort of grounding yourself in that. So even to the degree where I can walk out and just spend 10 seconds with my feet on the grass in my garden in the morning, and I'll just breathe some fresh air through my nose. I've never done that before, never. And now actually I can be like, oh, that's actually made me feel better,
Yeah, so. I saw a quote the other day. It said, that it used to be that I dream of traveling the world and seeing lots of different places. Now I just dream of being able to go to the local park once a week, and that's enough. But it's. I like the way you framed that. It's finding joy in new things. But it's that changing expectations, isn't it, about what life is like now? And a lot of my patients go through this massive, enormous grieving process of what has been lost before they can get to that point. And I'm sure you've both been through that.
Still doing it, still grieving.
Yeah. Massively. And it's being brave as well, knowing that you've tried pacing 20,000 million times and you've been knocked down that many times, but being brave enough to try it again, even though the odds are not with you and people around won't even understand, and that they might even weaponize it against you. Well, you did it yesterday, why can't you do it today? And overriding all of that and thinking, no, I'm going to try this and then I'm going to rest. And if it works, great. And I won't know straight away if it works or not, but I'm going to try it anyway. And it's a ride, but yeah.
I think I'm just gonna pause for a moment and say the fact that you both do so much for the community as well, when you've clearly had so many of your own struggles and put effort and spoons into that, is amazing. So I'm just going to put that out there, and you don't have to respond to that.
Thank you.
So Gez, Long COVID Handbook, published 2 years ago now, over 2 years ago in 2022, and that was really a amazing piece of work. So it was like a patient advocate who does YouTube writing with Professor Danny Altman, who's like, lead researcher in long COVID at Imperial, immunologist.
Yeah.
Just very briefly, are you planning on updating that? Any plans, and what would you put in it that kind of new? That's a big question, but
so I would happily update it if Penguin wanted me to. They haven't requested that yet. I think that as huge as long COVID is as a subject, doesn't seem to be something that people want to. I mean, I say huge, I mean over 100 million people worldwide, right? Yeah. But it seems that, books on the subject don't sell well enough for Penguin to want to necessarily do a second edition, or they haven't come to me yet about it. In any case, the book is still 98% current. I think which is amazing, really, and also a bit sad, actually. Yeah. If you'd said to me when the book came out, like by March, what are we, April 2025, is this book still going to be mostly current? I'd have said, no, we're definitely going to have some answers by then. And actually all we've really got are some more jigsaw pieces of the puzzle being filled in. But we don't really have the full picture yet. We don't quite understand the mechanisms that are going on. We don't quite understand how different everybody is, why people are different, why everybody gets a random selection of these 205 or 208 symptoms. The Recover study in America recently grouped people up into 5 phenotypes. But looking at those, there weren't really ones I recognized or seemed to make much sense to me. Like, what's it going to take for us to get to the place where we understand what's going on well enough to be able to phenotype people in a way that reflects the pathologies involved, that means that we can then recruit trials properly and then get positive results, rather than things like BC007 that fails. Did it fail because it doesn't work? Did it fail because it didn't have the right recruitment? Who knows? And then now that's dead, right? So that's gone forever because maybe we just didn't understand who to put in the trial. And that's a hard thing. So what
and a lot of these being set up to fail, I think, for exactly that reason. It's like a sledgehammer approach to everybody rather than a precision medicine approach of like, you will benefit from this treatment because you have X, Y, and Z markers in your blood, and this is what we know you're going to respond to. And that is a conversation I'm having over and over again with people all around the world. We know that this is what needs to happen, but no one's getting the funding to do it, sadly.
Yeah. So the research that I would be interested in putting into the book for the second edition would be some of the stuff around mitochondrial dysfunction, some of the more evidence we've got now about how the muscles themselves don't respond to activity or exercise the way that healthy muscles do. We've got really strong evidence now that they're not working right. We've also got quite a lot of evidence showing that the mitochondria themselves are damaged and not working properly, and some very good hypotheses about why that might be. That, I think, is very core to the ME/CFS subtype of long COVID. And then for the people who have dysautonomic symptoms, we're starting to get some interesting studies coming out showing that neuroinflammation, potentially even in the brainstem, could be a really strong driver of this autonomic crisis that manifests in all sorts of different ways. So we are starting to see bits and bobs of these puzzles, but we haven't quite got them fleshed out in themselves or quite linked into each other yet to know how everything fits together and what the flowchart would be for why one person is like this and another person is like that. I mean, maybe we'll get there eventually.
That is the dream. And I just want to highlight to everybody that Gez was a filmmaker prior to getting long COVID. You weren't a scientist in any way, shape or form, but you wouldn't know it.
I did an engineering degree. So my brain was set up in that analytical kind of way, if you know what I mean. But no, I wasn't a professional scientist or but
I'm blown away by every patient that comes to see me, who is just so well informed and researched and knows about this stuff and talks to me like, they are scientists because they've done all that. It never fails to amaze me, actually. And actually, I think that brings us on nicely to the power of patient-led research, because I think what COVID has done is it's shown us what the power of people and voices and patients and advocates coming together can really achieve, even though they're all really, really sick. And I don't think we've seen anything like it since probably the AIDS epidemic in the 80s, in patient power really transforming things. And we're still not there, are we? But, both of you obviously are pretty expert in these areas. But what's your thoughts on that, Gez?
I think it was very important early doors in terms of giving us answers as a patient group that we couldn't get from anywhere else. And the medical community takes a little while to get the huge cogs turning, right? It's like a huge steam train. That's
a kind description, Gez.
Yeah. And I think that steam train looked like it was kind of getting off the move, and now it's kind of run out of coal a little bit, and it's still kind of chugging along, but we really need to have some more coal thrown in that steam train for the establishment. But I think there's still a place for patient-led research, and I think it's to ask the questions that sort of the establishment won't ask. And I think one of the studies that I think was most interesting to me that I did was, I think, maybe even my most recent one, which was looking into the impact of long COVID on sex, dating, and relationships. And that's not something that you're ever going to have a university. Well, then maybe they will look into it, but it's not pressing. But the impact it has on people's quality of life in terms of what this illness does to their close relationships and parts of their life that may be a huge part of your identity and a huge part of the way that you, it's just, I think it's, people were commenting in the comments earlier about how even close family don't understand, and it's such a hard condition to understand. And to have this issue quantified in a way that, when I say quantified, I mean put together so that we can see I think about 700 people responded to that survey I put out. And everybody can then say, oh my God, it's not just me who's struggling with my spouse, with my cousins, with my parents-in-law, with my parents, my children, whatever, right? It's so, and again, it comes down to so much. I don't know how we change that. I don't know how you give people an insight into a condition that is as nebulous and invisible and intangible and I'm just throwing out words that mean the same thing here, but fluctuating. It's so difficult to grasp, right? And the thing that when I'm talking to somebody new who doesn't know anything about long COVID, and they're like, so it's not just like shortness of breath then? I'm like, no. I'm like, there've been 2 studies that have compared quality of life to advanced cancer and found that long COVID is as bad or worse. That's how severe it is. But cancer has a certain, you know what I mean? People get it, right? But people, you say long COVID, they don't get it. And I don't know what we need to do to change that. Patient-led research has some role in that, but media has a huge role too.
The support groups have been huge. I mean, Helen, like the amount of peer support that long COVID sports provided is just incredible.
Yeah, and it's the first time in history that we've had opportunity, seems the wrong word, but we have had the opportunity to do that. And I think also it's worth mentioning as well the big elephant in the room when it comes to social media. A lot of social medias are problematic in the way that they're run. And of course, lots of people have been leaving social medias because of that. But actually, the really great thing about social media is you get back what you put in. You end up in algorithms and you can use that as a learning tool. Of course, it can go in a very negative route as well. But if you're very careful and you're mindful and you're aware of that, then you can use it to your benefit. And that's exactly what has happened with patients who have felt otherwise completely isolated and lonely and have no support at all. And it's enabled support to be there in I can't imagine what it must have been like 20, 30 years ago and before, throughout history, medieval times after the plague, long plague. And obviously it was a thing, it must have been so isolating to have been in the village and have no one to talk to and to have no understanding, and so in a way we are very lucky, but also, but we can use that information, and we're the first generation to have that opportunity. So I think exciting seems wrong to use, but it's
harnessing it in the right way, isn't it? And I think Long COVID Kids was an absolute, godsend for us when we were struggling and we didn't have any support. And that's coming from a doctor who's in a medical community with no support. So I'm just conscious of time. I really did want to do a hard stop at 40 minutes because I want Gez to get his skiing in tomorrow. Gez, your YouTube channel, we haven't really had a chance to talk about it. You repurposed it. You turned it into a scientific, amazing, just communication tool. It's had over 6 million views in all your videos. You've done well over 100 videos now with interviewed world experts and all sorts of people, haven't you? And the ripples from that, I think, have been enormous. I used to send patients links to your videos when I was going to start them on, some off-label treatment. I would be like, watch this video because he interviews the world expert who's done the research on this thing, and you'll know why I want to prescribe this for you. And then we can talk about risks, benefits, etc. That is mad, though. If you think about it, I'm signposting to some random bloke's YouTube channel to do medical research counselling, but that's the position you found yourself in, right?
Lived experience expert.
I'm sorry, Gez, I should have called you random bloke.
No, look, random bloke. I was such a random bloke at the start that my name wasn't even on the channel. So I put out the first video, and the channel was still called Run DMC because it was going to be about running, and it was going to be about my DeLorean and other classic cars and stuff.
Yeah.
And so it took me a while before I'm like, okay, this channel name doesn't make any sense. It needs to change. But until that point, they're like, who is this guy and why is he talking about this stuff? So
it
I
was
had to
confusing.
Yeah. So I did have to change that. And I thought, let's just call it me and then it's all fine. But yeah, I mean, I guess I was a random bloke in the right place at the right time who just had a YouTube channel that was ready to go. I was a filmmaker anyway. I had my own camera. It was straightforward for me to do that. And yeah, it was just a time and place thing. Had I caught COVID in the second wave, not the first wave, I probably would have never done any of it because long COVID had already been a thing. I'd have never done it and no one would have heard of me in this world because I'd just be like everyone else being ill. Yeah.
Well, look, I think this is a really nice comment to finish on from Reese, who just wants to say a big, massive thank you. And early in the pandemic, watching your videos, Gez, was such a lifeline in coming to terms with the illness. And I think we can all probably say that it was for all of us, actually, who were trying to learn about this new thing. And it's a real privilege to be able to call you a friend. And just do look after yourself, though. Keep up the amazing work. And same with you, Helen. You're both very inspirational people. And just thank you so much for the chat this evening. And I just wish well, yeah, I'm trying to muck in, do my bit as well. But
yes.
But thank you so much.
Can I just quickly respond? Leanne Morland asked, where can we find that study? If it's the one on sex, dating, relationships, it's on my YouTube channel. If you write in sex, Gez Medinger, you'll find it. Or just do relationships, Gez Medinger, you'll find it. Yeah.
Don't do that on a work computer.
No, quite. Yeah.
Right. Brilliant. Lots of thank yous as well. Mana has said, can you take us skiing as well? She can get down.
No problem.
Sorry. Lovely. Right. Yeah. I'm gonna hit the button and let you get some rest, Gez. But thanks very much, and I'll see you guys in a couple of weeks.
Nice to meet you, Helen.
Take care. Bye, everyone.